Many dentist offices are beginning to reopen. Dr. Kami Haas joins us now to explain what you need to know before your next appointment. Good morning. Good to see you.
Good morning, Shelly. Nice to see you again.
Dentist office, unless there was an emergency for the past few weeks, even into months, went offline. But it's important for people to get back in. Why?
Well, obviously, oral health issues don't just pause because there's a pandemic, right? In fact, according to ADSO, every 14 seconds, someone's ending up in the ER because of a dental problem. And of course, oral health impacts overall health. As you can imagine, the surface of your mouth are contiguous with your trachea and lower airway. So it impacts every part of the body, including the lung health, which is so critical during this pandemic. And of course, so for all those reasons, it's really critical to your dentist. This is not one of those situations that you can just wait it out.
I was lucky enough to get to my dentist yesterday. I've been waiting and waiting and waiting. I needed to go get some.
How was it?
It was really good, and I felt super safe, and I saw all kinds of things that they were doing different. And I was actually asking her, what have you done to get ready for people to come back? So what are dentists doing right now to keep the offices safe for the patients? Which, by the way, she said most dentist office, because of like the way that you keep things clean so much, is an extremely safe place.
I know one could argue that actually dental office lobbies are probably the safest indoor places to be. And I can explain to you why. First of all, to begin with, like you said, we've been doing this for decades, making sure that we keep everything clean, and we have amazing infection control protocols already in place. But we've added a lot of things for this particular virus. And that starts with making sure that this virus stays out of the office to begin with, as you can imagine. So what patients should expect when they call their offices back is a very thorough health screening on the phone. And then that gets repeated before you walk in. There's going to be physical checks like temperature checks. And again, these are all done to make sure that every single person, including the patients, the people that might have to accompany them if they're children, and then the office staff and the doctors are screened every single time before they walk in. So we only going to have healthy people inside the office. Mm-hmm. And of course, the lobby is going to look different, the waiting room, those amenities that you used to, like the magazines or the coffee, or we're a pediatric dental office, like games and toys, those will be gone. But many of those have been virtualized. Like, for example, in our situation, we have a virtual waiting room now, so you can check in from your car. You can be entertained. The kids can grab mom or dad's phone or tablet and watch movies and do video games. And the parents can fill out their paperwork digitally on their phone or tablet in their car, and we can exchange that. Once we're done with the treatment, we can communicate with the parents live on a video conferencing, very simply on what the progress is. And that's all just in the waiting room changes. And of course, in the clinical side, many things have been changed. We've modified some procedures to make sure we don't produce any aerosol or reduce it significantly. We're using some really, really awesome new technologies to make sure the aerosols don't leave the mouth. So as you can see, we've done everything from A to Z, and we feel very good as a profession to welcoming our patients back to our offices.
Yeah, one of the concerns, Dr. Kami, during the time that this was all closed, I got quite a few messages from dental hygienists and even dentists saying, this is a profession that you are really up in someone's mouth with the water and the saliva. So there's obviously a concern if they're saying that the coronavirus can be transmitted through water droplets, and you're the dentist like right there. Mm-hmm. So I saw a lot of different gear yesterday that I didn't see my dentist wear before, but you're online with that as well, a lot more personal protective equipment.
That's a very, very good question, Charlie. Thanks so much for bringing it up. So not only we want to keep the patients safe, we always want to keep our doctors safe, we want to keep our staff safe. These are all our own families, right? So one of the things that, as you just said, we are at a very high-risk profession. We're working with saliva in the mouth. And so that's what we've done, many things to make sure. First of all, it's always prevention is the best cure, right? The best treatment. So the best thing is to make sure that saliva does not leave the patient's mouth. So we have a lot of new technology that we've added with very, very high-speed suctions and all of those, UV technologies and everything to make sure that the saliva doesn't leave it. But on top of it, at the very last thing that we should rely on is the PPEs, and that's also critical. But dental offices are not going to open until they have secured enough PPEs for their employees and for the doctors. And we've done the same thing. We've spent literally the last 6 to 8 weeks, as you're probably aware, across the world, and across our country, there's a huge shortage of PPEs. And that was before dental offices were even open. So you can imagine with dentistry now reopening across the country, there's going to be continuous shortage of these. But none of the dentists are going to be opening their practice until they're absolutely sure they have enough PPEs for their staff to keep everybody safe, and that includes us. We spent the last 6 weeks to make sure that we use all of our resources, our relationships to make sure we have everything ready to go for everybody to be safe.
I went to the dentist yesterday and I felt very safe. And I was excited for the first time to go to the dentist because it's usually not a place I want to go to.
You know what? I'm so happy to hear that. I've actually heard that from so many people because, going to the dentist is usually not on top of people's list. And so, in a way, people have this guilt-free past of not going to the dentist, but that has come to an end. So I'm really excited that you were very happy to go back to your dentist, and I'm sure a lot of patients are going to be happy that dental offices are reopening.
Because it just feels normal. Dr. Kami Haas, we appreciate it. Thank you.
Thank you always. Take care.